Hi everyone, I am Dr. Srinivas Nistula, Chief Gastroenterologist and Hepatologist at Medicover Hospitals, Visakhapatnam. Today I'll talk to you about liver transplant. So first of all, as the name suggests, liver transplant is we are transplanting a new liver into a person whose liver is completely spoiled or it is diseased. So what are the indications of liver transplant? So who are the patients who require liver transplant? So to start with, lot of patients who have end-stage liver diseases because of either alcohol abuse or hepatitis B virus infections or hepatitis C virus infections or other diseases like autoimmune hepatitis or Wilson disease in childhood. So all these patients who have chronically damaged liver, so these patients qualify for getting a liver transplant. There are some young children or some adults whom the liver will get damaged very quickly in a very short span of time. That is called as acute liver failure. In these kind of patients, the liver will become from 100 to 0 within 7 to 10 days of time. So in such cases also, we can offer liver transplant to these patients. So broadly, we have two types of patients who require liver transplantation. Number one is chronic liver diseases or end-stage liver disease, where the patient will have liver damage ongoing for many years, for more than 10 to 15 years. The second group is acute liver failure, where the patient will have a liver damage for a very short duration, but the damage is so severe that the patient cannot recover because of the illness. In those two situations, we require liver transplant. So what are the types of liver transplant? Number one is diseased donor. So if, for example, some patient dies because of a brain stroke or because of some other issue where the patient is declared brain dead by the doctors, those kind of patients can donate liver. Second is living donor liver transplantation, in which the close family relative of the patient can donate. For example, mother and father can donate for a child, brother and sister can donate for an adult patient. So broadly, there are two types. One is deceased donor liver transplant. Second is living donor liver transplant. So in deceased donor liver transplant, the whole liver from the donor is taken out and is transplanted into the patient. But in case of a living donor liver transplant, only a portion. For example, if it is a young baby, only 1/3 of the liver, or if it is an adult male, half of the liver is transplanted into the patient. Basic differences between the types of liver transplant. And usually the patient has to get admitted in the hospital. The whole surgery will last around 6 to 8 hours. The patient stays in the ICU for 6 to 8 days, and then the next 1 week he stays in the ward, and then he goes back home. Usually the whole process lasts around 10 to 14 days. The patient has to be on, number one, lifelong immunosuppressant, and he should be on regular follow-up. So most of the liver transplant programs have a very good success rate of around 80 to 90%, in which the patient will be completely cleared of the previous disease and he'll have a very healthy life after the liver transplant. But the patient should be on regular follow-up, and he should meet the gastroenterologist or the hepatologist at regular intervals, initially maybe weekly or 2 weeks, then gradually every 1 month, then every 3 months, and then every 6 months, or as and when required. In short, liver transplant is a life-saving procedure, especially patients who are suffering from long-standing liver diseases like chronic alcoholism or hepatitis B or hepatitis C related diseases, or then patients who have this obesity related liver disease, also called as NASH or excess fatty liver disease. All these patients will definitely benefit from liver transplant, especially when all the other medical therapies have failed. Acute liver failure, liver transplant is the only option because there is no way out that we can buy the time for the patient. So in such patients who are having acute liver failure with all other organs functioning normally, liver transplant is the treatment of choice. We at Medicover Hospitals are doing diseased donor liver transplant at our center in Visakhapatnam. Thank you.